The Victorian era was a time of remarkable scientific discovery, yet it was also an age of crude and often brutal medical practices. Surgeons worked with limited understanding of infection, anesthesia was in its infancy, and patients often faced procedures that were as dangerous as the conditions they sought to cure. Today, we examine the most fascinating and terrifying medical instruments of the 19th century, revealing a world where innovation and agony walked hand in hand. In the 19th century, amputation was often the only recourse for severe infections, gangrene, or battlefield injuries. However, before the widespread use of anesthesia, these procedures were performed with the patient fully conscious, their limbs held down by assistants as the surgeon worked with speed and precision. The bone saw was a staple of the Victorian operating theatre. Unlike modern surgical instruments, these saws were designed for brute efficiency, their steel teeth slicing through bone in mere seconds. The most skilled surgeons could complete an amputation in under 2 minutes, any longer, and the risk of fatal shock or hemorrhage increased exponentially. Yet, the true danger came after the procedure. Without sterilization, infections such as sepsis and gangrene often claimed more lives than the surgery itself. The mortality rate for amputations in Victorian hospitals could be as high as 50%, a stark reminder of the limitations of medicine in this era. Bloodletting, an ancient practice dating back to the Greeks and Romans, persisted into the Victorian era. Physicians believed that many ailments, from fevers to mental illness, stemmed from an imbalance of bodily humors and excess of blood needed to be removed to restore health. The scarificator was an evolution of the lancet, designed to make multiple shallow incisions simultaneously. A physician would apply the device to a patient's skin, activate the blades, and then collect the blood in a glass cup or apply leeches to further drain the excess fluids. While some patients reported temporary relief, the practice was often ineffective, and excessive bloodletting could lead to severe anemia, weakness, or even death. As medical understanding advanced, the practice was largely abandoned by the late 19th century, replaced by more evidence-based treatments. Before the advent of modern tonsillectomy techniques, the Victorian solution for chronic throat infections was swift and brutal. The Tonsil Guillotine, designed for rapid removal of inflamed tonsils, was a favored tool among surgeons. The mechanism was simple: a ring-shaped blade encased the tonsil, and with a single squeeze of the handle, the tissue was severed. There was no anesthesia, no sterilization, and minimal post-operative care. The patient was expected to recover naturally, often while enduring significant pain and blood loss. Although the method was undeniably efficient, it carried severe risks. Uncontrolled bleeding, post-operative infections, and even fatalities were not uncommon. Thankfully, by the early 20th century, more controlled surgical techniques replaced this harrowing procedure. Trepanation, or the act of drilling into the skull, dates back thousands of years. In the Victorian period, it was still considered a viable treatment for head trauma, epilepsy, and even certain psychiatric conditions. The Trephine was a precision instrument designed to remove small sections of the skull. The goal was to relieve pressure from swelling, release trapped bad humors, or, in extreme cases, treat mental illness by freeing disturbed thoughts. While some patients reportedly survived and even experienced relief, others succumbed to infections, brain damage, or shock. Despite its risks, trepanation laid the groundwork for modern neurosurgery and cranial decompression techniques. One of the most commonly used medical instruments of the 19th century was the syringe. Designed for administering everything from pain relief to vaccines, these syringes were often made of brass or glass and lacked the sterilization methods we take for granted today. In hospitals and battlefields, syringes were used repeatedly without proper cleaning, spreading diseases such as syphilis, tuberculosis, and septicemia. Pain relief was administered with morphine or opium-based laudanum, both highly addictive substances that created an epidemic of dependency among patients and soldiers alike. Despite these risks, the use of syringes represented a turning point in medical treatment. Over time, advancements in sterilization and single-use needles drastically improved safety, marking the beginning of modern intravenous medicine. The Victorian era was a time of medical revolution, an age where science and suffering coexisted in equal measure. These instruments, though often crude by today's standards, paved the way for the life-saving procedures we now rely on. They remind us of the cost of medical progress, and of the resilience of those who endured it. What will future generations think of our medical practices today? Only time will tell. Subscribe for more historical and medical documentaries.